Started. All right, so my name is Melissa Street, and I just want to give a quick backstory on how my husband and I came across Impact Health Sharing first. Primarily, my husband and I, we are self-employed, independent contractors, business owners, and so for years, if we wanted health coverage, we went to the marketplace and bought health insurance. And so for years, we had a company that I don't want to disclose their name just for privacy reasons, but their logo had a blue cross and a blue shield. And we were paying almost $1,000 a month in premium just for the two of us. And our family deductible was $15,000 in the event something happens. And, we thought that was normal. We didn't really know there were alternatives. We didn't know there were other options. That was just kind of the norm, right? We went to Marketplace and had a health insurance agent to kind of help us guide a package. And we paid $12,000 a year for just in case. And thankfully, my husband and I, we are fairly healthy. And if we ever used our health insurance plans, it was for like that wellness visit and just in case, in the event of a catastrophic situation. And then about 4 years ago, a friend introduced us to Impact Health Care Sharing. And the first thing they did was they gave us a quote. Our cost went from $1,000 a month to a little over 300. So personally, as a family of two, we saved almost $8,000 a year in cost. And so that just totally raised awareness for us of what are we doing and is this even legal and how does it work, and tell us more. And as we dove into the concept of healthcare sharing as a whole, we realized, wait a minute, this is something that the masses need to hear about. And as we dove into Impact as an organization, that's when we really felt like we were on this crusade of just sharing impact to as many people as we can. And then we formulated this webinar. And so fast forward today, my husband and I, Jeff, we have been Impact Health Share members for about 4 years. We've been extremely pleased with the experience, from the enrollment process to our wellness visits, the concierge included. My mom is an Impact member, and almost exactly 1 year ago today, it was actually exactly December of last year, she had to go to the ER, first time using Impact, and they just came in and advocated for my mom. And, mom is mom. That's your special place in your heart. And so I was just so happy to hear of a health sharing organization that really stepped up for my mom in her time of need. And so if you're here just kind of exploring your options, I'm excited for you to learn more about Impact. And so I'm going to dive into a lot of information today. So just bear with me. I know it could be a little overwhelming because it is so much good information. But remember, we host this call every Tuesday on the same code at the same time. So you are always welcome to log back in here. But the first thing I want to share with you guys before we dive into Impact is just where we are currently right now. So since 2020, over $275 million in medical expenses have been shared within the community. Over 19,000 lives are impacted by becoming an Impact member. And in the last 5+ years, Impact has had no universal rate price increase at all. And for my providers on the line today, providers love working with Impact because the payout time is about 15 days or less. And so you get paid more and you get paid faster. And so more and more providers are coming on to this Zoom call, for example, just to see how this could be such a benefit, not just for their practice, but also for their patients. Now, I'm sure you've seen all over the headlines of health insurance premiums increasing for this new year. Many of you, that's the reason why you were invited onto this Zoom call, is because you got your renewal for 2026 and your jaw is still on the floor because the cost is so ridiculously high, right? Just a couple weeks ago, a friend of mine referred his daughter to me. She's in her mid-30s, a family of 4, husband, wife, and 2 young kids, and their renewal for January of 2026 on with traditional marketplace insurance plans was $3,200 a month. That's $3,200 a month. for her renewal, that's a mortgage payment. That's more than a mortgage payment. And so we took care of her with Impact for $628, which was super exciting. But she's just one of the many millions of Americans that are just faced with seeing sharp rate increase, drastic rate increase, and it's so unaffordable. People are scrounging on finding answers, finding solutions, finding alternatives. See, the truth about healthcare right now is 5% of the population is responsible for 50% or more of the annual healthcare spending costs. So this indirectly means that most people are overpaying for their healthcare costs every single month. 80% of the country is trying to lower their healthcare costs as a whole. And over 100 million Americans are in some form of healthcare debt. This is a massive problem, but some major truths about healthcare. What Impact recognized, what most healthcare providers recognize, is what people want. People want affordable monthly premiums. People want affordable out-of-pocket expenses like copays and deductibles. People want to choose the doctor they want to go to. I mean, doesn't that just make sense? You want to go to the facility and the doctors and the physicians that you want your family to see. And employers, my business owners on the line here today, you want to be able to afford health care for your staff and be able to offer it. But with the cost and the increase of this new year, unfortunately, a lot of business owners have to pull back on that and find ways to not be required to offer healthcare just because it's so outrageously expensive. And so when it comes to Impact, who is Impact for? So healthcare sharing may not be for everybody, but for many individuals, I'm talking about millions, especially those who are generally healthy, it offers an affordable solution like no other. So I want you to think about anyone that pays for some or all of their own healthcare costs, or families and individuals that don't have healthcare because they just cannot afford it. So individuals, families, self-employed entrepreneurs, gig part-time workers, service industry workers like hairstylists, massage therapists, waiters. A lot of the times they're renting a station, or they're renting a booth. They don't necessarily own the business, but they're not necessarily employees of the business. They're still contractors, right? Senior citizens ages 65 and older can, as long as you have Medicare Parts A and B, can have Impact as a secondary plan. And then business owners, our niche market is for those that have 49 employees or less. So honestly, anyone and everyone is a great candidate for Impact Health. But as you learn more information today, you might be able to solidify if this is a good fit for you personally or not. So let me just talk about some benefits of Impact Health sharing. Actually, before I go into that, let me just say this. How many of you, prior to being invited on this Impact call, prior to learning about Impact, how many of you were already familiar about healthcare sharing as a concept? Like maybe you've heard of Samaritan Share, Christian Health Ministries, Meta Share. Okay, I see some hands, I see some shakes. Okay, great, good. So for those that have their hands up, the model works. It's been around for 40 years, so it's not a new concept. So for all my new people that's just trying to grasp the idea of healthcare sharing, just know, peace of mind, this is not anything new that people are trying. Again, it's been around for 40 years. But one of the reasons why most people don't know about healthcare sharing is because primarily it's founded under the faith-based communities. So like, Christian Health Ministries, for example, you have to be a Christian to be invited into their organization for healthcare plans. So I mean, I'm a Christ follower, but at the same time, I have friends that aren't. And this is an opportunity where Impact is a love thy neighbor approach. They don't care your race, your creed, your religion, your occupation, your income bracket. Impact is a healthcare plan for everybody, a love thy neighbor approach. The second thing that people love about Impact Healthcare sharing is the fact that they have what's called reference-based pricing. So it's kind of like an advocacy program where, in the event you go to the hospital and you got this big medical bill and you're like, man, like I just don't have the energy to fight with the company to buy down this cost. Like I don't have the resources or the knowledge. I love that Impact literally is there to help and defend on your behalf with what's called reference-based pricing or fair market value. They will help you with that negotiation process when a provider bills Impact. A couple of other things that people love about Impact is just the way that it manages billing. You're going to see that here in a moment, but Impact, just like all the other health sharing organizations, it's not insurance. We're not labeled as insurance, but it is an alternative to health care plans. And so one of the things that people love about Impact is how they have what's called an EDI payer ID number. So if I were to go to the doctors today and they say, hey, hand me your insurance card, I'm not there to argue with them that Impact's not insurance. I'm just going to give them my Impact membership card because on the back of the card, there's the billing code, just like any major health insurance company has a billing code. And so there is the electronic feel of billing directly to Impact. The reason why that makes such a big difference is because for all my people that had the raised hand, when I asked who had heard of healthcare sharing before, in those amazing traditional health sharing programs, you already know going into it that in the event you have to go to the doctor's office, you would pay out of pocket first and then seek reimbursement. That's how the traditional model works. With Impact, again, it's the most modern and contemporary feel of healthcare sharing. So they have the billing code where the providers can bill directly to Impact. Now, I want to share some language that I know it's going to take a minute to just kind of readjust our brains because we've been socially conditioned to understand certain verbiages when it comes to healthcare. So in the traditional insurance world, what you would know as deductible, which is your out-of-pocket expense, right? You have to meet your deductible before your insurance company kicks in, right? So what you would know as deductible, Impact calls it a primary responsibility amount or PRA. So you're going to hear us say PRA a lot. What you would know in traditional insurance world with copay, which is basically in the event you go to a specialist or urgent care or hospital, right? You have to pay a certain copay. With Impact, it's called a provider fee. Same concept, it's just different different words. Third is covered or coverage. You hear that a lot. When does my coverage start with insurance? With Impact, or a covered medical expense. With Impact, it's called eligible for sharing because again, healthcare sharing is about a community approach, sharing each other's medical expenses. All right. So you're going to hear eligible for sharing. And then what you would know as co-insurance in traditional world, which is traditional insurance world, is after you've met your deductible, there's still what's called a co-insurance. And most insurance companies, it's usually a 70% to 30% rule or a 80% to 20% rule where, insurance company pays 70%, but you're still responsible for 30%, right? That's what's called co-insurance in traditional insurance world. With Impact, it's called co-sharing. Same concept, but with Impact, it's a 90-10 split. So with all your eligible medical expenses and you've met your PRA, Impact will share 90% of it and you're still responsible for 10% of it. The most an Impact member as a family or an individual will pay out of a co-share amount is $5,000. So Impact is not insurance. It's something better. In my personal opinion, now being an Impact member for almost 4 years, the savings alone was so significant. I told you my first year as an Impact member, I saved $8,000 a year in insurance premiums when I made that switch. That was 4 years ago. I can't even imagine what marketplace costs would be today for my husband and I. And so some bullet points I want to share with you about Impact is no provider restrictions. So you love your doctor and you want to keep them? Great, keep them. You don't love your doctor? You really want to have another choice? There's no provider restriction, no network restriction. Choose the care you want to get. Comprehensive health care. What does that mean? That means anything from small to big. So maybe it's a cold or a sinus infection, or maybe it's a wellness visit, or maybe it's a pap smear, or maybe it's a cancer treatment, to an organ transplant, to a helicopter ride, ambulance ride. It's everything from small to big. The reason why that's also a big thing is because a lot of health sharing organizations are only for catastrophic coverage. So only the big stuff, which means all the other little things, especially if you have young kids and they go to the doctors a lot, those are all out of pocket. So with Impact, it's comprehensive and anything from small to big. A couple other things I want to highlight is a complimentary 24/7 telehealth, a wellness visit for all family members, lab work credit up to $150 per member, as well as dental and vision discount savings program for all members in the household. So we love that. Last thing I want to share with you guys as far as why Impact is greater is wellness rewards. If you spend any money on these items, save your receipts. I'll explain. So first off, if you spend any money on direct primary care memberships, like that concierge primary care memberships that's really trending right now, naturopathic services, naturopathic medications, gym memberships, fitness class or subscriptions, maybe you have a Peloton subscription, massage therapy, acupuncture, supplements. If you spend any money on anything that's a holistic approach to your health, maybe you buy clean laundry detergent, clean makeup, if you buy clean baby formula, if you buy really honestly anything that is towards a healthier lifestyle. I know it's almost the new year, so you probably have some resolutions on lose weight and make more money, right? So if the lose weight part is part of your resolutions and you hired a gym trainer, or you signed up for a meal plan, hey, again, those all of those, everything I just mentioned, save your receipts, because as an Impact member, you can apply up to $150 of wellness credits each month to basically offset your PRA, or like I said, PRA, new language, right, is similar to what your deductible is with insurance. So basically $150 every month to buy down your PRA. So Impact, they want to keep you healthy. They want you to stay healthy. They want you to live longer. So they're going to reward you for choosing healthy lifestyles. I mean, that alone just deserves a round of applause, I feel like, because isn't that what healthcare should be? Choosing healthier lifestyles and live longer, right? So save your receipts. They will recognize that for wellness rewards. You can submit it very easily. Once you become an Impact member, there's a portal specifically to submit your expenses. So that being said, last couple of things is I will post a link to the Impact guidelines in the chat momentarily, just so you can have a copy of it. Impact is very straightforward. It's all about ethics and honesty. Man, that sounds refreshing when it comes to healthcare, right? Ethics and honesty. There's no gray areas, right? And with pre-existing medical conditions, what Impact deems as a pre-ex condition are any conditions that are signs, symptoms, testing, diagnosis, treatment, or use of medication occurred within the last 36 months prior to enrolling for Impact's membership. So any sign, symptom, treatment, use of medication currently right now, until it's been free of for 36 months since the last occurrence, that will be labeled as a pre-ex condition. Now, that does not disqualify you for getting Impact. So if you're sitting here going, man, I do have some pre-ex conditions, that means I can't sign up for Impact. No, not necessarily. You just need to use discernment. So in some cases, some of these pre-ex conditions are very minor. Like you don't really go and visit a doctor or get like active treatments every month, or maybe it's like a one-time situation, but it definitely happened within the last 36 months. You can still enroll for Impact. They just won't share for the medical expenses towards that condition until it's been treatment free. So for example, Okay, I'm gonna show you a real life example. This is a gentleman in Colorado that when he was evaluating if he should sign up for Impact Health Sharing, actually, let me do this really quick. So this is a gentleman in Colorado that prior to enrolling for Impact, he was paying thousands of dollars a year with traditional insurance, and he was just really trying to save some money and look for alternatives. So when he looked at Impact, he was going to save thousands of dollars a year in premium costs. But he goes, but I do have a pre-X condition. I have a blood clot in my leg, and it doesn't happen often, maybe once a year, but definitely since the last occurrence, it was definitely within the last 36 months. So I said, well, weigh out your pros and cons. What would the cost be if you had a situation and you had to go and pay out of pocket? Is the cost of out of pocket less than what you're saving had you made the switch, if you made the switch from traditional insurance to Impact Health? And he was like, man, I'm saving literally over $10,000 a year if I make the switch. So I'm just gonna go with it because it's very rare that I have a blood clot situation. So sure enough, sign up for Impact, fantastic. Couple months later, had a blood clot, had to go to the hospital. And this is actually his medical bill. So even though it was a pre-X condition, the hospital billed Impact. And Impact, like I mentioned earlier with their advocacy program, they helped him with the fair market value of the price. And so his medical bill was $5,751.28 for that blood clot. When Impact received the bill, they repriced it and negotiated off $5,130.75. That's amazing. So his out-of-pocket expense was $620.53 for that blood clot. And like I said, it was a pre-existing condition. So he knew going into this that he was going to be paying out of pocket because it's a pre-X. But he was gladly to pay that $620 because, again, he was saving over $10,000 in premium when he made the switch to Impact Health. Now, since then, this is in 2023, he has not had any situation since then. So if it goes another year, then that's no longer considered a pre-X since the last occurrence that he had. So the last thing I'll share here is with high blood pressure or high cholesterol. I had someone ask me this late last night. I have high blood pressure. Is that considered a pre-X? It is a pre-X, but it will not be considered a pre-X condition for for purposes of determining eligibility for future vascular or cardiac events. All right. So high blood pressure and high cholesterol, as long as it's being maintained, you got your medication, you're staying healthy, it will not be considered a pre-X condition for purposes of determining eligibility for future vascular or cardiac events. So as I wrap up here, before I introduce our next speaker, this is our Facebook group. Feel free to join it. You don't have to be an Impact member to join the Facebook group. Use it as a resource. People share their testimonials in there. People ask questions in there. It's just an opportunity for people to learn more about Impact. So with that, I am going to turn the Zoom call over to my co-lead, Mr. Jeff Street.
Awesome. Well, thank you so much, Melissa, and excited to be on the call with everybody today. And, I get a chance to go over some more information with everybody. But the first thing that I want to, share with you is, as Melissa mentioned, when we were introduced to Impact Health Sharing about 4 years ago, and we got our quote and looked at what we were going to save. For me, I was really excited about the savings, but I was also really cautiously optimistic. And maybe some of you can relate to that. And for me, as I started to peel the onion back and learn more and more about Impact Health Sharing and healthcare sharing in general and understood why it worked, I went from being cautiously optimistic to just really being a major crusader or an advocate to what this company was doing. And here's what really made it make sense to me. Melissa had mentioned this earlier on, but I just want to really put everything together for you. As Melissa mentioned, 5% of the population equates to 50% of the healthcare spend in our country. That means the other 95% of the population equates to the other 50%. I was part of that category. So most people are healthy or fairly healthy and significantly overpaying for their health insurance because of the fact that they have to compensate for people that are not healthy. So as Melissa mentioned, healthcare sharing is certainly not going to be the right fit for everybody. For people that are healthy or fairly healthy, this decentralized nonprofit alternative to the high cost of health insurance can be a major game changer to so many people that are healthy or fairly healthy. And so what I realized was, because we're bringing on people in our community that are healthy or fairly healthy, it's driving the risk factor way down. And that's why they're able to go out and offer pricing that's so much less than traditional insurance for most people, because they're limiting the risk factor by having a community of people that are healthy or fairly healthy. So Melissa mentioned, what pre-existing conditions were and how impact is not going to be the right fit for everybody. So what is impact for? Impact is for new accidents, new illness, new injuries. Melissa mentioned your primary responsibility amount. Your primary responsibility amount is like a combined family deductible. It's the amount that entire family would pay. And then once that amount has been met, then at that point, you go into co-sharing. So you're responsible. So the impact community shares in a 90% of your medical bills. Once you've met your PRA, you're responsible for the remaining 10%. As Melissa mentioned, that's called your co-share. And the most that a family could ever pay per year in co-share is $5,000 a year per family. Now, I'm going to show you a few examples of some medical bills here in a few minutes, where you'll see somebody that had a medical bill that had not met their PRA yet, somebody that was in their 90-10 split, and then somebody that had met their PRA and it also hit their max out-of-pocket expense of that $5,000 co-share mark. And that'll put a lot of this together. Now, pricing with impact starts as low as $73 a month for individuals, $378 a month for families of 3+, and $96 a month for seniors 65 years old and older. Now, how do you get a price? How do you get a quote for impact? It's really simple. All you need is the date of birth of the oldest person in the family and the number of people that are in the family. So let me just show you really quickly what the affiliate link, what the referral partner website looks like. So this way you can see how simple it is to get a quote. And it's very simple. So whoever invited you onto the call today, they're a referral partner with Impact Health Sharing. So they have their own affiliate link that looks just like this. And all you have to do is write on their portal, right on their website, just type in the date of birth of the oldest person in your family and the number of people that are in your family. So let's say the date of birth, the oldest person in the family is March 30th, 1989. And let's say it's a family of 3+. So you type in that information, you hit get quote, and it's going to generate 4 different options for you. Now, one thing I love about Impact is there's nothing confusing like traditional insurance. There's not a million different plans to choose from. Every single program is exactly the same. The only thing that's different is the primary responsibility amount that you choose and the standard rate that you pay. Remember, primary responsibility amount is just like a combined family deductible. So every quote for a family or an individual under 65 has the same 4 options: a $2,500, a $5,000, a $7,500, and a $10,000 PRA that you can choose from. Now, the lower your primary responsibility amount, the higher your standard rate's going to be. The higher your primary responsibility amount, the lower your standard rate is going to be. So you can see for this particular quote, if that family chose the $2,500 PRA, they'd be paying $576 a month. If they chose the $10,000 PRA, they'd be paying $404 a month. Let's say somebody that was that same age, 36 years old, let's say it's just one single individual. We can change it, get quote. There's the quote for that individual, anywhere from $102 a month to $246 a month. Let's say that family happened to be born in 1979. It's a family of 3+ that's 46 years old. Get quote. There's the quote, $433 to $605. So hopefully you can see how simple it is to just get a quote. Now, right here at the bottom of the page, there's an AI chatbot named Ellie. So once you get your quote, if you have questions, all you have to do is just go right to the chatbot, and you can literally ask the chatbot any questions you want, and it'll answer any question that you have. Now, after that, if you still have questions, you can actually submit yourself in as a lead on your referral partner's website, name, email, phone phone number, click on request information, and somebody from Impact Health Sharing is going to reach out to you with a text message or an email with a calendar invite to schedule a time to have a call with you and get any additional questions that you have answered. If they answer your questions the way you like and you decide to become an Impact member, then at that point, they'll direct you back to your referral partner's website and you can click on enroll now. And it takes only about 15 minutes for somebody to enroll. Now, somebody can enroll as a general membership, a guardian, or a group membership. Most of us would be a general membership. A guardian membership would be for somebody that's under 18 that has a parent or a family member legally responsible, or a group membership is going to be for if you're part of a group of a company that's enrolling in Impact. If that is you, all you have to do is put in the last four of your social and it'll connect you with the group that you're a part of. Again, most of us will be a general membership. There's a one-time application fee when you or your family signs up for Impact. It's $79 per family. It takes about 15 minutes for you to go out and enroll, and then your membership will begin the first day of the next calendar month. Now, one thing that's very important right now, I know a lot of people are looking to have a January 1st start date with Impact. If that's the case, just make sure that your enrollment is complete at latest by 5:59 Eastern time tomorrow, December 31st, in order for you to have that January 1st start date. So again, any month that you enroll, your membership will always begin the first day of the next calendar month. There's no open enrollment period with Impact. You can become a member any time of the year. And here's just a couple examples. A 26-year-old individual, the plans start as low as $73 a month. But now as we show you the Impact membership card, Impact is architected to look and feel like traditional insurance for the member's experience. When you go to the doctors, you give your Impact card just like you would your insurance card. And as Melissa mentioned, Impact invested the money to be in all the clearinghouses in the country. So they have an EDI payer ID number so they can be billed the same way a commercial insurance company is billed. Now, as Melissa mentioned before, most healthcare sharing companies, when you go to your doctor, you always have to pay up front as a cash pay discount and then wait to get reimbursed here by your healthcare sharing company, which sometimes could take several months in some cases. Now with Impact, it's different. Again, we can be billed like a commercial insurance company. Now, however, because normally healthcare sharing members pay up front, sometimes there is going to be what's called provider pushback. And I just want to be 100% transparent with everybody so I can prepare you for what you may have to deal with. Now, as long as you're okay with this part, this is going to be phenomenal for you, like it's been for my family. Some providers, especially if you're the first Impact member that's been there, they might say to you, hey, well, this is healthcare sharing. You have to pay up front first. Now, if you ever hear that, say, look, I know that's the way it normally works, but ours is different. Look at the back of the card. You can put our payer ID number and bill us just like an insurance company. Now, many times they'll just do that and they'll say, wow, this is great. You're right. Sometimes they might not do that. And they'll say, no, you got to pay up front. Listen, I know that's the way it normally works. If you have questions, just call the provider support number on the back of the card. They'll tell you how fast Impact pays and how much Impact's going to pay. Now, when a provider calls Impact, usually at the end, they're blown away. They're like, wow, this is amazing. Now, as a worst case scenario, if for whatever reason, they still will not bill Impact, just pay as a cash payer at the cash pay discount, get the treatment that you need, and then submit your bill to Impact. Now, as long as you've met your PRA, Impact will reimburse you as the member as quickly as they're paying their providers. Now, if you're a provider on the call, you'll love that. This Impact is processing and paying medical bills in under 15 days time, and they're paying typically 130 to 160% of the Medicare rate. So they're paying providers faster, and they're also paying fair market value. So if you've already met your PRA and you have to pay as a cash payer, Impact's going to reimburse you as fast as they're paying their providers. If you haven't met your PRA yet, whatever you pay on that medical bill will just get applied towards your PRA. Now, a couple of things, if you look at the front of the card, remember every Impact member gets a free annual wellness visit, which ladies, you can use that as your ladies visit as well. Also, remember Impact's concierge program. And I'm going to give you a tip. If you're taking notes, write this down. As a new Impact member, I would encourage all Impact members to go get your free annual wellness visit in your first 30 to 60 days as a member. Here's why. We want Impact to have a relationship with your primary care provider. And Impact has a concierge program that's unlike anything that you've ever seen in this industry, where once you make that appointment to get your physical or your annual wellness visit, if for any reason your provider does not bill Impact, the Impact Concierge program will actually provide a credit card and actually pay for your wellness visit before you even walk in the door. So this is amazing. Providers never get paid before a member walks in. So this will allow Impact to establish that relationship with your primary care provider. Also remember, every member gets $150 blood work credit per year. Every member also gets 50 outpatient therapy visits per year as well, with no provider fees. Outpatient therapy is chiropractic adjustments, physical therapy, respiratory therapy, occupational therapy, you name it. 24/7 free unlimited telemedicine with Doctegrity. If you want to go back to your primary care physician after your physical, you can, no problem. It's a $50 provider fee. Urgent care and specialists is $75, and ER and inpatient is $150. Now, once you go to your provider and you give your Impact card, Impact will now bill your provider again, like commercial insurance, just like I showed you. And so here's just a few examples. This is my mother-in-law. We took her to the emergency room in Highland Village, where we live, last year, right around this time of the year. Her medical bill was $2,500. She hadn't met her PRA yet. Impact negotiated that bill down to $164.98. That was her responsibility. Now $164.98 was subtracted from her $2,500 PRA. Now, here's another Impact member. This is a good friend of mine in Houston. His two sons needed to get their tonsils taken out on the same day, fun day as a father. One bill was $65,000. The other one was $46,000. Impact said that's not fair market value. They advocated on his behalf. One bill went to $6,400. The other one went to $5,700. Now, this member had already met his PRA. Now he's in his 90-10 split. So you can see the community shared in a $5,770 on one bill, $5,130 on the other bill. His responsibility was the 10%, $641 and $570. Now, the other thing I want to show you real quick is what the Impact back office looks like, what the Impact member center looks like. This was the glue for me. This is when I saw Impact's transparency. See, normally healthcare and transparency are usually not said in the same sentence. Now, when you look at Impact's member center here, let me just see if I can get myself logged into Impact's member center here, so you can see what this looks like. This was really what made this just amazing for me, seeing again what Impact was willing to do from a transparency standpoint and how they showed everything it was that was going on in the community. So here's my personal account for Melissa and I. This is decentralized reserves. Myself and all the other Impact members, we can log in and we can see real time what's going on in our account. Right now, I have $2,100 just sitting in my share account. I can see what families I've recently helped. The Wesley household, $236. The Rajan household, $236. The Goldscheider household, $236, and so on. You can see how all the money moves. I can see what's gone towards the share amount. What have I paid that's gone towards administrative fees, program fees, everything. I can see everything. Impact just has full transparency. I can even see what's happening in the community. How much money do they have in financial reserves? How fast are they paying medical bills? What were the biggest shares last month? I can see right now there's $15.1 million sitting in Impact's financial reserves. You can see over the last 12 months, they shared in a 76,973 medical bills. They shared in a $14.4 million in medical bills over the last 12 months. Now, the goal of a healthy health sharing company is to have 3 to 4 months of financial reserves. You can see how right now Impact has more money in reserves than they've actually paid in medical bills over the last 12 months. So our model is working incredibly well. You can see here on the bottom, last month they were processing medical bills in 10 days' time, sharing them in another 4 days. For providers on the call, you're blown away by that. Here's the largest shares last month, the Koch household, 142,000, and so on. These are real people that a community is sharing into their medical bills in the time of need. And the last thing I'll show you guys is this. Remember, Impact is rewarding people for living a healthy lifestyle. So for Melissa and I, we have the $2,500 primary responsibility amount plan. Our plan started July 1st. We submit our $150 health and wellness credits every month, and we also go to the chiropractor a couple times a month. So check this out. Even though we've had no medical bills this year, we've used more than half of our PRA already, just because we're able to basically buy down our PRA or buy down our deductible by living a healthy lifestyle. Just from those $150 credits over the last 5 months and our chiropractic adjustments, we've already used over half of our PRA. Now, I am going to have my first ever colonoscopy later on this year. I'm intentionally going to do it 9 or 10 months into my plan. And at that point, we'll have literally used our entire PRA just from our chiropractic adjustments and health and wellness visits. So I love how Impact is rewarding people for living a healthy lifestyle. But it is my true privilege right now to bring somebody up to the call that's going to, that's actually from Impact Corporate. And this individual is somebody that has had that has an incredible reputation in our industry. Not only is she Impact's chief brand officer, but she has spent 3 decades in the direct selling industry, primarily in executive education and thought leadership. She worked with Success Magazine for many years. She's collaborated with hundreds of companies, founders, world-renowned authors, speakers, and she's somebody that just really goes out and takes Impact's brand and makes it something that's just touchable for the common person, understandable. Her expertise is in brand strategy, creative storytelling, producing and directing live experiences designed to connect with people, elevate ideas, and really create meaningful insights for people. And we're so honored to have her on the call today, guys. This is Impact's chief brand operator, Shelly Rojas. Everybody, Shelly, thank you so much for being on the call here with us today.
It is my pleasure, and thank you so much, Jeff and Melissa, for the invite and for having me today. It's so nice to meet so many of you. I heard a few people in the beginning say they were from Fort Worth, Texas, so I'm over here a little north of that in Keller. So hello to all my North Texas friends. Appreciate you being on, and as well as everybody. So, a little over a year ago, I was actually just like a lot of you that raised your hands or said, "Hey, I have no clue what healthcare sharing is." That was me. I kind of had heard of it, but had no idea really what it was. And similar to health insurance, I had health insurance through my employer over the years, but I didn't really fully understand how insurance worked. I just knew that every time around this time of year, I got a packet to renew, and every year for my family of 4 it went up. That's kind of my experience with insurance, right? And my family is also very blessed and fairly healthy, but we've had the things happen. I have 2 young boys who are in sports, and life events happen, and you just kind of again show the card and then deal with the bills when they show up. So that really is my experience with insurance until coming on board with Impact. And I've also never worked for a nonprofit organization ever. But what I did know when I was interviewing and considering Impact for my next path in my career, the ownership and the culture and the values of this organization, that's what aligned with me and what attracted me. So the integrity, the honesty, the providing real value, and most importantly, putting people at the heart and center of everything. That's what I was really excited about. So, as Jeff mentioned, I've been doing lots of things over the last 30 years in the creative field with all sorts of people, companies, business owners, celebrities, authors, etc. But no matter what the project was or the business was, For me, it always really does come down to the people, who you're spending your time with, what you're doing, and et cetera from there. So I'm going to share a couple little slides as we go through this. See if that is everybody seeing that? Yes? Okay, good. All right. Okay, so for me, like I said, people. So with impact, this is what we at the root of everything. It is healthcare built for people, not profits. Again, we are a nonprofit, and with people, that's what makes the experience can make it really great or not, right? And sorry, my screen is all over the place. There we go. Um, so that's what I bought into. It was about the people and the fact that it has real meaning and a real purpose to help people. And I'm not your typical marketer or brand strategist. I have to believe in what I'm a part of, and I truly do believe in impact. So our philosophy is simple, affordable, transparent, modern healthcare built around people. And we don't pretend to be something we're not. We understand that healthcare sharing isn't for everyone. And impact is just not a better form of insurance, as Jeff mentioned earlier. It's not just better for the sake of better. It's actually a different model altogether. And there's a saying in marketing that different is better than better. And I truly believe that impact is different in all the right ways. And this model works best for people, as Jeff and Melissa shared, for people who are fairly healthy to healthy and prioritize living well. And this is how we're able to provide that up to 50% savings on average per month. And then the meaningful support and the financial come through, right? On all those examples that they shared with the bills. That's how we're able to do that when the community needs it. And one of the ways that I feel that really attracted me was, again, that transparency and integrity. And especially when it comes to what I know most of you wonder about, right? It's like, will this really work? And will they pay for things when I need it, right? That's what everybody's concerned about if you're not familiar with it, because it is different. And from day one, our president and CEO, Phil Chrysler, he intentionally designed it so that the members' funds are never commingled, meaning that community funds are designated to pay the eligible medical bills are held in a completely separate account from the funds that are needed to run the operation in the organization. So those funds are never mixed, they're never blurred, no questions. And as Jeff showed in the member center, you can see that every member has access to that member center every day, every minute of the day, 24/7. You can go in there and see where all the money's going and where it's being attributed. So I appreciated that level of clarity, and that the fact that it wasn't an afterthought, it was actually built from the very beginning. Like this, he wanted to put a staple line in the sand. This is how we're going to be different. We are going to be very transparent so that everybody feels comfortable and knows exactly what's going on. And so we were also, and here's just a screenshot that I took this morning of the same member center that Jeff took you through, just to show exactly kind of what that looks like when you log in and the access to the information that you get. So we were actually the first healthcare sharing organization to integrate this type of transparent technology in the member center so that you can see that at any time that you want. And additionally, so I think that Melissa went through this earlier too. We're very proud to say that our industry-leading payment processing to the providers, 15 days or less, the fact that collectively since the beginning of Impact, since 2020, the collective members have saved and shared over $270 million. And that's the members' community money. That's not Impact the organization, right? That is the members sharing in each other's bills and needs. And then also, again, just have to reiterate that we are very proud that while everybody else in the industry is raising prices and raising increases, not only just in the insurance side, but also in healthcare sharing, some of our, our brothers and sisters out there in the healthcare sharing industry, they are also raising rates or charging for things that weren't being charged for before. And we're just very proud to be able to say that for 6 years, as we go into our 6th year here next month, we have never issued a universal price increase to members. So it's stability that you can count on, because that's we feel is important. right? We all have bills, we all have things that we have to pay for. And as everything continues to get more expensive these days, we are just so proud to be able to offer something stable. As you're looking at your list of budget items, you don't have to worry about, is my healthcare going to go up? It is what it is. So that's something we really take a lot of pride in. So next, I want to talk about the innovation side of our philosophy and some of our core pillars that impact. And we're very intentional about that, both from the technology side as well as just innovation and experiences and adding more value for our members. And, Jeff touched on a couple of those things earlier with our wellness concierge that we launched this last year as a way to say, hey, how can we make that new member experience not only just so easy and get them to use one of their complimentary benefits, which is the annual wellness visit. And then how can we also help that new member introduce impact to their provider and be a partner in that with them? So that was, again, an innovative way of like, hey, how could we make this a better process for our members? And then another example from a few months ago, we added a complimentary short-term teletherapy for all members of any age. So we recognize that mental health is a growing need in America, and we wanted to provide a practical way for members to get the support that they need. Now, every member has access to 3 virtual visits per month, per topic, every month through our virtual care partner. And again, at no additional cost. So we are always looking for ways. We have a dedicated team that's always ideating and looking for new partners and things that we can add to value to your membership without charging you more. So we have a full complimentary suite of things. Jeff and Melissa touched on a lot of those, of where we're always trying to look. We call them our member perks, of things that we can add to the membership and add to the community without charging you more for it, to add value. Because we do truly believe, like, it isn't always just about getting new members in. We want to take care of the members that we have, because especially from being a brand person, it's about the experience, right? Our job is to take care of our members and make sure it's a good experience beyond just initially becoming a member and those initial monthly savings and annual savings that you have. We want your experience with us throughout to be fantastic, and we want to maintain you as a member year after year. So whether it's the tech forward, transparent member center, having access to all of that information, we also have, we upgraded our RX, our pharmacy engines this past year as well, that they now scan. This powerful engine scans all thousands of pharmacies and thousands of manufacturer discounts every single day, so that when you go in to look up your prescription that you need to get filled, you're getting that day's absolute best price that's available. So we're super excited about that. Was a new benefit, and that we were able to add to the community to save you even more. And then our streamlined billing processes, I think Jeff touched on it. It's such an easy, again, modern tech way. You upload a picture of something, an image, it submits it through, and then everything starts happening in the background to move that bill through the process to the repricing and everything it goes through. And then again, the complimentary perks, the wellness rewards, those are all things that we, not just from a tech standpoint, from just an innovating and adding value to the community and the membership. Okay, so in this year, something very exciting we're launching. We did a pre-launch actually at a recent event with Jeff and Melissa, and we're very excited to officially launch it in the new year. Is a truly innovative, first of its kind, immersive VR experience that's going to travel the country, community by community. And our president and CEO, Phil, had a simple but powerful vision to create a way for people to experience how impact is different. Again, healthcare sharing is new to a lot of people. It's a foreign thing. So how can we get this in front of people to help more Americans that are really struggling with all of these rising premiums to realize that there could be an affordable alternative for them, and that can help people stop overpaying for healthcare if they don't have to. And so this is a 36-foot truck. It's beautiful and it's amazing. But what happens is you can go through the back end. So there at the back, you'll see there's actually stairs that come down. And you go into this initial room and you go up to the monitors and you do a couple questions, very simple things, just so we can get a better idea of where you are in your phase of life and what kind of your family looks like, etc. And then you go into a second room where you get to sit down and have this amazing VR experience with this headset that comes down, and you get to watch a story of somebody that's similar to where you are in your life and how impact just really works in every day, what that's like. Because, right, when you're looking at something new and different, it's like, what's it really going to be like? How does this actually work? And, again, I'm a storyteller at heart. And so showing that through the power of story, we feel is going to be really impactful and really bring it to life for people of what we do and what it's like with impact. So Jeff and Melissa, you guys did a great job going through all the details of the program. So I'm not going to go through that again and repeat any of that. I wanted to take a minute to share a little bit of a different perspective and, take you behind the scenes. So as I've come on board and working with the amazing team at Impact and the founding partners and everything, it's just been a really wonderful year of learning not only about healthcare sharing and the business, but just working with these incredible people. And a few months ago, we had our first ever leadership retreat. So we gathered for a full day, all of our directors and above that work for Impact. And some of us had never met in person because we're a remote organization. So to start the day, I asked everyone an icebreaker question. And that question was, if you had a superpower for one day, what would it be? And if I didn't already know at this point, so this was I'd been with Impact for about 11 months at that point. If I didn't already know the culture and heart of this organization, this one answer from one of our team members says it all. And this is what I want to share. She was a member from our billing team. So she's one of the ones that if you have a bill and have a question or they have a question, she's one of the people that you'll talk to and reach out. And she said, if I could, my superpower, I would want the ability to heal so that I could heal our members that are in pain and having these medical issues that they're having. And she shared how fulfilling, but sometimes difficult emotionally, right? That is to work with members who are going through these challenging health situations and, how their stories just stay with her long after the calls. And her words sparked so many emotions for all of us. And then others that interact with our members started sharing not details of people's situations, but the connections with the members and just how heartfelt it is and the ups and the downs and the wins and we all ended up having tears in our eyes just because it was like, wow, this is really what it's all about. You could just feel the care and concern. And for me, it was one of those just verifying moments that, like, man, I chose the right organization to be with because look at these people that they truly do care about what we're doing and our member in the community. And it's hard to describe what that moment felt like. And this is what I wanted to share with you that's what it's like when you join Impact. You are a real person. You're not a policy number, right? So our team carries your stories in their hearts. We pray for you, regardless of your religious choices. I mean, we respect those and honor those. And we will always work to make things right within the guidelines to keep it fair and transparent. Reality is no company is perfect. So mix-ups and errors are bound to happen. But at Impact, you do have a community and a staff that truly care about you and want the best for you and will work with you to find the solution and make it right. So I know that healthcare decisions can feel really overwhelming, especially when you're considering something new and different. And I don't know if Impact is right for you, but if it is, I wanted you to know that enrolling in Impact just isn't about the healthcare. It's about a community that's built on integrity, heart, and a genuine commitment to people. And that's what I have learned in my year so far with this organization. And it's just an honor because every decision we make, every innovation we pursue, every meeting, conversation, tool that we create is guided by two simple questions. How can we make it better for our members? And how can we add more value? So that's why I chose impact. And after spending my career working with hundreds of organizations, I can honestly say it's rare to find a company that truly is so intentionally designed to put people first. It's so refreshing to work in an environment where leadership, teams, culture are all truly aligned. We're doing the right thing isn't just a value that's written for the about page on a website. It's actually a filter for every conversation and decision. So here at Impact, you are a real person. You're working with real people. Yes, we have technology. We have Ellie, our AI chatbot. Those are just ways to get you the information you need as quickly as possible. But there are real people behind the scenes working for you and working with you, and people who are carrying your stories with them. They care deeply about your challenges, and we love to celebrate the wins too. We love having the new babies born into the organization and all of those wins and overcoming certain medical conditions. We celebrate those with everyone. And just to close it here, I just want to say there's the part that always surprises people is that this is what healthcare can feel like. We're proud to redefine it and to stretch ourselves to redefine what healthcare can be. And we want to continue to make it clear, human, and empowering. And it's always built around you, the person, not a system, and never profit driven motives. So for me, that's the impact difference. And that's what I'm so proud to be a part of. So thank you so much for having me on today and allowing me to share.
Shelly, thank you so much for being here with us. I don't know if you're able to just stop sharing your screen there for a second, but so grateful for you being on today's call. Guys, this completes our last impact call for 2025. Just a couple quick last thoughts. Just remember, if you are looking to start your impact membership for January 1st, make sure you complete your enrollment by 5:59 p.m. Eastern Time on December 31st in order for your membership to begin on January 1st. For those of you wondering, is there a business opportunity here as well? The answer is yes. If you want to learn more about being a referral partner and how you can earn residual income, sharing the good news about impact to individuals, families, and small businesses, and earn residual income doing so, make sure you get back to the person that invited you on the call to let them know, I want to learn more about being a referral partner. And speaking of referral partners and that amazing van that Shelly showed everybody, in Dallas, Texas, where I live, we're going to be having our 2026 referral partner kickoff event on January 10th in Richardson, Texas. And that immersive technology van and impact health sharing are going to be there with us at that event. So if you're anywhere in the state of Texas, know that January 10th in Richardson, we're going to have that van with us at our referral partner kickoff event for 2026. So Shelly, thank you so much for sharing the heart of impact and your heart on the call here today. This truly is people above profits, and we love doing healthcare this way. So God bless everybody. Happy New Year. Have a very, very safe and incredible start to your 2026. I wish for all your dreams to come true in 2026. God bless, and thanks for joining our call here today, everybody.